Good morning, Sanbonani. Welcome, everyone. I'm Qureisha Abdul Karim, the Associate Scientific Director of CAPRISA, and I'll be the Program Director this morning. And by my side is Dr. Disebo Makaza, and she will be the Co-Program Director. Disebo is the Site Director for the Vulindlela Research Clinic. So we both extend a very warm welcome to all of you. We want to thank you for taking time this morning to be with us to, one, celebrate World AIDS Day, to celebrate huge progress that we've made in terms of making AIDS a condition that was inevitably fatal to one that is chronic and manageable. But we also have lots more to do before we can say we can pack up our bags. But before I do anything more, I want to start off by acknowledging and recognizing some very important people in our audience today that are part of the celebration. As we have worked to respond to the AIDS response in this community, it has been a partnership with the community. It has been a partnership with the Department of Health, and it has been a partnership with the scientists, and all coming together have enabled us to mount a response in this community that I think has made a difference, not just for this community, but beyond. And so in the course of this morning, you will be hearing from each of these key partners. And so because of COVID, we all have to remember COVID protocol. We all have heard about Omicron. And so in the interest of keeping all of us safe, we are here in this open, well-ventilated area. And we're trying to keep each of the presentations very short. So what I'm going to do is recognize most of the distinguished guests that we have with us today. Everyone is really important, and that's why you're here. But some special mentions that I need to make so that subsequent speakers don't need to follow the protocol and don't need to spend additional time acknowledging the distinguished guests, and we'll say all protocol observed. So I want to start by recognizing Nkosi Zondi. She's not with us right now because she happens to be having another meeting and may be able to join us a bit later this morning. With her is the Induna Magwaza, who's the Induna of this particular ward. We have with us Councillor Mshengu, who's the newly appointed ward councillor. I gather that all the swearing in of new political appointments are take place this morning, so he's hoping he can be here in person. If he's not, we want to acknowledge him. We have Reverend Sitoli with us, and we'll do brief introductions of each of them, but I want to acknowledge them. Reverend Sitoli particularly do a shout out because he's here today, even though he is celebrating 36 years of being married to Mrs. Sitoli. And clearly they've had a very wonderful, loving relationship over this time. We have with us Pastor Mlochwa, welcome. We have Ms. Sibongile Shabalala, joining us from the Treatment Action Campaign. Unfortunately, she had an accident on Friday, and we're just very pleased that she's doing well, but we'll have messages from her. We have messages from Dr. John Kengasong, who's the director of the Africa Center for the Disease Control. We have, very importantly, from the Malazi family, on whose land this facilities are, with us this morning. Yetwana Malasi joining us. We have Dr. Kulu with us through a message. She's the CEO of SANAC. We have a message from the National Acting Director General from the Department of Health, Dr. Crisp. We have Dr. Shabalala, who's the Acting Director of Strategic Health Programs. We have Dr. Zulu from the Department of Health, our District Manager. Welcome. We have the Director of CAPRISA, Professor Slim Abdul Karim. We have from the World Bank, Ms. Marie-Francois Marinelli. We have this afternoon a CAPRISA Board of Control meeting, and we're very pleased that one of our board members, Ms. Alex Notier, is here with us. And then we have other funders and sponsors who support our program, particularly the U.S. Centers of Control, Disease Control and Prevention, that support our EPI programs, and representative from the U.S. CDC, Ms. Reina Tabak Ezra, with us. And as I said, all of you, if I haven't mentioned you by name, I want to recognize you as very important guests here with us today. And most importantly, I want to welcome Dr. Janet Froelich. Dr. Janet Froelich is a very special person. So I kept that not last, but because this is the most important guest we have. Without Dr. Froelich, we wouldn't have this facility here. She was the first director of the center. Together with Getwana and May Mashego, they were the first 3 appointments. But Janet came here when there was nothing. And what we see today is the foundations that she laid. She was here leading our treatment program, where we initiated over 5,000 people on antiretroviral treatment between 2003 and 2005, and led the CAPRISA 004 trial. So Janet, special welcome to you, and we're really pleased we are. So with that, I'm going to now move on to the formal part of the program. And we're going to start very traditionally with an opening prayer. And we're very pleased that we have what's called a community research support group, which has representatives from the community that are elected and nominated by the community that serve as the buffer or the group between the scientists and the participants. And our inaugural chairperson, because each person appointed to this group actually has a fixed term of office. And Reverend Sitoli was our first CSRG chair. But he also is a minister of the Reformed Church of South Africa in Kwamkane. And at the time we arrived here, there was no antiretroviral treatment. So the mortality rates, the morbidity rates were very high. And we were seeing about 12 or more funerals every weekend. And I remember the first time I met Reverend Sitoli, he was like, this is not why I became a minister. I became a minister because I wanted to officiate over weddings and happy occasions and births of children, and all I'm doing now is funerals. And he had the foresight, the insight to take care of the many orphans that were left in this community, and continues to do feeding schemes and a very active part of this community and support. So Reverend Sitoli, please officially to open the function. Hand over to you. Sorry, Sam. Too enthusiastic.
Sanbonan, greetings to Prof. Croatia, Prof. Salim, Dr. Janet, and all the distinguished guests, Pastor Mlojwa, the traditional leaders, and everyone, greetings. And this is very important day, and we come very far. And I said to Prof, I'm happy that you still remember me. And if you come to the age, especially of 65, people are forgetting you. And I'm happy to stand here to do just what God has called me to pray. But I have to thank the CAPRISA, thank the service they give to us, to remember us at Vulindlela. It's a rural area, it was easy to you to work at Umlazi as you do, to work at Kwamashu and other places, but you just chose to be with us. And I can say the forgotten people. And we are not forgetting anymore because of you. The world knows about Vulindlela, and the world knows about our traditional leaders and the most upliftment of our children. We gave them some practicals and things like that. And we thank the focus. And we also thank you, CAPRISA, for the research and everything. And today, yes, we can say we can live with our people because of you and your research, because of ARVs and things like stuff like that. And I believe to you and that we are potential, gifted. Even this new epidemic, I heard the president said, "You're going to live with us." And I said to my son and my wife yesterday, yes, we are going to live with it as a TB, as HIV and AIDS, we are living with it, because I trust that the researchers will do something better. Thank you. Ngicela ke njengabantu besihlabelele, and mina ngumfundisi ake sihlabeleleni. Masimbonge, masimbonge, oh no, saga, simutande, simutande, simukonze, emi, sange, Alleluia, Alleluia, mokolo, mo saga Jesus, amen. Simenyiwe namhlanje oku yaku. Singahlala phansi. Nkulunkulu Baba, Yise wenkosi uJesu, we come to you this day in this fashion. We come to you very humbled. We come to you to plead with you as our God and our Lord. In this place, Lord, we remember everything what has happened in this community and all the KZN and the country of ours, the South Africa. We come to you, Lord, to ask you to heal our land. We have seen many things. We have seen many sickness. We have seen many diseases came to us. But through you, we have survived. We survived the HIV and AIDS. Although our children, our daughters, our beautiful young one has passed away, our sons and daughters, our mothers and aunts, our people, our friends and relatives. But we still stand here because you, Lord, has produced, we have put the mind of research to our professors, to our academics. We have given them the gift to do the work so that we can survive. We thank you, Lord, that we can stand here while we know there was a time of crying every day, every week. Through the work now, we can stand and say, thank you, Lord. has been 20 long years. People put together their mind. Professor Karim, Professor Curesha, Janet and others helped this community and the world as a large to be healed. I can say, Lord, we are healed because we can live even though these diseases are still there. We see the years progressing. The years our people are prolonging. We see, Lord, that you are there. You have touched us. I pray, Lord, for this new epidemic, the coronavirus, the COVID-19, and all what is come with. I pray, Lord, that it must not destroy us. It must not destroy our country. It must not destroy our loved one. I pray, Lord, that one day, even this vaccine, it will become stronger as the HIV medicine became strong. Lord, I pray, even though I know that we have sinned against you, we have done many things which you are not happy about us. But we come to you as a loving God. We come to you as our Father. You said you are our Father in heaven. We believe to you that you will never perish us. You will never forget us. Lord, as we continue with this day and continue with these 16 days of the violence against women and children, we pray that our male, our boys, our sons, give them the mind to respect their sisters, to respect their girls, to respect each and every one. We pray, Lord, that we must not mention the name of violence against women in our country. It must stop, and stop right now. Siyabonga ukuthi uNkulunkulu ozwayo. Siyabonga ukuthi usizwile. Siyabonga ukuthi uyalalela. Ulalela ukunxusa kwethu. Ulalela ukukhala kwethu. Siza kuwe ngamadolo njengoNkulunkulu ophilayo. Izindlebe zakho zisizwile. Uthe isandla sakho asifinyeziwe ukuba sisindise. Namadlebe akho wasindi kuba usizwe. Nkosi hawukela. Nkosi lalela. Nkosi ithethelela. Nkosi bona inyembezi zethu. Nkosi bona usizi lwethu. Nkosi bona ukuthi sikhethwe sayikheswa ezizweni zonke zomhlaba ngenxa yotwayi lwethu. Ngenxa yokugula kwethu. Nkosi senze ukuba singabi ngabogcina kodwa sibe izinhloko. Philisa izwe lethu. Ngaphandle kwakho asikwazi ukuphila. Ushilo Nkosi Jesu wathi uze kithi kuba sibe nokuphila. Sibe nakho ukuchichime. Sikhankeza lokho kuphila. Sipheke lokho kuphila. Egameni lika Kristu inkosi. Amen.
Thank you so much, Reverend Stole. That was really great. I thank you for the work that you're doing in this community and that wonderful prayer that you've opened with. Ladies and gentlemen, distinguished guests, all protocol observed, I now have the pleasure of introducing the Inkosi that will be addressing us today. Inkosi Magwaza is the Nkosi of the Inadi ward here in Mafagatini. He has served as a councillor and of the Msunduzi municipality for the past 8 years. In that 8 years, he has served this community as part of the tribal council and plays a key role in addressing all the immediate needs of community members, including housing challenges, the reduction of crime and unemployment in this very community. Inkosi, siyakubonga namhlanje. Induna Magwaza. I apologize. Thank you so much. Induna Magwaza, thank you so much for joining us. Can you come and address us, sir?
Anginibingelele ngizokhuluma lolu limi engalincela ke mhlambe bese ngesikhathi engethula la noma kuthanda ukubonakala kodwa konakalanga kakhulu ngoba njengoba ngizofaka isixoliso sikandaba ezitha kuye kuthiwa indaba esawesizwe mengekho umuntu osuke uyena in charge kuba yiyona induna ngalo ndlela ngicela ukufaka isixoliso sikandaba ezitha ubanjwe yiflu inkosi yamanati indaba ezithu zondi ngimxolisele egameni lamanati mhlambe ke umuntu angafisa ukwenza waphela fanga bukhona lokho kubukhona ke engizokusho bekuzokwenzeka ngisho eyingekho inkosi kodwa isihlalo sawo siyahlonishwa savuma induna phansi bese sizongibeka icala kusho ukuthi masibingelela ke abesilisa ke kuthiwe bayede indaba ezitha bese bayithi siphamise izandla besifazane mase siqeda bese bethi inkosi ngisho kahle ndweni shuthi sizocela senze okuwusiko ke lwethu lwesizulu kuze noma nduna uzongisiza ungilidele. Okay, so phamisa izandla sithi bayede indaba ezitha bese sithi bayede bese sithi abesifazane bethi inkosi izandla besifazane abaphakamisa ngicela ukwenza ke baye sisukume mfundisi sisukuma abesilisa bayasukuma besifazane bahlala phansi abesilisa akasukuma bayede indaba ezitha bese sithi besifazane inkosi. Hayi i-translation zoyidinga ke mayifanele waza uzotranslate.
Thank you. Ubaba Magwaza is actually emphasizing that even in the absence of Inkosi, we need to continue to greet him because we are not actually respecting the actual person, but you are respecting the position. So that it is for that reason why you were saying Bayete Inkosi.
Thank you very much. Angibonge not to translate. Mhlambe engizophinde ngiphakamise emcimbini namhlanje engifisa ukuthi ngingaqhubeka kwenzeka kwezinye insuku. I-first citizen endaweni zamakhosi kuye kube inkosi. Ngiyakubonga lokho engikubona la namhlanje ngoba esikhathini samanje kwi-government amakhosi asebukele kaphansi. Angikubonge lokho engikubona la ukuthi yaziswe i-first citizen ukuthi endaweni zamakhosi amakhosi wona ama-first citizen. Thank you very much.
We truly appreciate that CAPRISA have actually noted the leadership, the traditional leadership. Hence, we've seen also in other places, but particularly here, we understand that the first citizen is Inkosi, and then all of us then we therefore, after that, follow.
Bekuncaneke ngikusukumele ukuba nginamukele nonke endaweni yaseNadi kwaVulindlela la kwakhe khona uCAPRISA sizibongela ukuthi sizibone indaweni yaseNadi ithuthuka bese ngiphinde ngiqinisekisa ukuthi cha bengakayijoveli iCovid kodwa mhlawumbe ngizothi ngiphuma manje bengiyijovela ngoba bangitestile kwathi hayi nginegative kahle ngoba phela masilide umphakathi kuthiwa silide example ngizothi ngiphuma ngibe ngiyijovela ke kodwa hayi bengakayijoveli.
For me, my duty was just little. It was just to make sure that I welcome each and every one of you here. And also, I truly appreciate your presence, but also the development that we have seen over the years here at Inadi, Vulindlela, and the work that is done by CAPRISA. And I'm also want to say that not yet vaccinated, but I've been tested and I tested negative COVID-free. So I hope that thereafter I'll also go and vaccinate because leaders are led by example.
Ngifisa ukuhlala phansi kodwa ngifisa ukuhlala phansi ngingakamboni uSiskethwane angimboni ngibone nje bhalwe phansi.
May I see Siskethwana?
Isizathu salokho ngikhule ngaphansi kwabo sikhuliswa ubaba wabo le ndawo sikhule bekwamasimo ukutshalwa amazambane la kodwa ekukhuleni kwakhe ngicathi lethu ngikhula obabe bona babefuna le site kwakuyiphupho labo sisigejwane angifisi ukuthi simbonge nje namhlanje ngoba abanye bayahlonishwa ngezakho thizeni ngelinye ilanga ke siswethu omdala so ofisa le ndawo libe khona mhlambe emlandweni okufakwa kobe kuthitha ugejwane mahlase ngoba thina sazi satshala amazambane ngifisa ukubonga.
It is normally known as the field for potatoes, where they normally plant for potatoes, but because of the vision of the family of Mahlase, they actually offer this particular place to the to CAPRISA, or they donated this particular place to CAPRISA to make sure that we continue to do research in this particular place. Therefore, I want also to acknowledge the family of the work that they've actually done over the past years, and for giving this particular land to the family of Ketwan. The history should judge us right in that regard. Thank you.
Thank you very much, Induna Magwaza, for both welcoming everyone on behalf of the community and on behalf of Nkosi Zondi. We wish her a speedy recovery and hope to see her amongst us soon, and for her to also celebrate the extensions and the renovations here. Now, as I mentioned earlier, our next speaker was going to be, word of welcome was going to be from Councillor Duduzi Mshengu, and he is being officially sworn in as we speak. So in his stead, to welcome us and all of you is Mr. Shlanshla Mtembu. So please welcome, and over to you.
Sanibonani nonke. NguNhlanhla Mthembu. Ngikhuluma egameni lekhansela elisha lentuthuko uMduduzi Mshengu. Ngizocela lana ukubingelela uma ngabe kungenzeka ngizomcela nami uzongitolikela ngoba mhlambe ngizothatha usuku lonke mangabe ngize ngapha bese ngiza ngapha. Ngithanda ukuthi njoba la sisendaweni yamakhosi ngibingelele ondaba ezitha ngibabonile bakhona sakhuleka ondaba ezitha. Ngibingelela abafundisi, ngibingelele oprincipal nabahloli abanye ngibabonile, ngibingelele umndeni wakaMahlase ngokukhethekile, bese ngiphinde ngibingelela uCaprisa. Mina ngifisa ukuthi mhlambe engezubabiza lama ngibabingelela kodwa ngifisa ukubingelela nje nonke ngononi nawe nenduna zami. Phinde ngibongele induna yami uMagwaza esesemusha uphuma eboxini ngeke nduna la endaweni yaka Ward 9 yakhelwe uMpumuza namafakati. Ingakho ngithi ke uWard 9 umlando wawusho kanjalo ukuthi sinoMpumuza bese siphinde siba neNathi. So ke ingakho ngithi ke kulesi sikhathi esikusona njengamanje sibonge kakhulu uCaprisa into asenzele yona. Sik-understanda ke nokuthi isimo esikusona njengoba siku-level 1 njengamanje okuningi okunye kwethu sincishiwe kona. Kodwa ke sibonge nje kakhulu ukuthi uhlelo abasiphe lona nokuthi ke la ngoba phela kusuke kuuhlelo lokuthuthukisa isizwe nokubheka umphakathi la ngoba ikona kakhulukazi esike siqikelele ukuthi abantu isizwe siyaphepha. Ngizocela ukuthi ngime lapha bese ngithathela ubafona.
I'd like to greet each and every one of you, and also continue also to welcome you in this particular place, and also I also welcome particularly Induna Magwaza as a newly elected councillor.
Councillor uMduduzi Mshengu.
As a councillor uMduduzi Mshengu as a newly elected, and also greeting to Babu Magwaza. We are here at Kwampumuza, which this is the area where we are. And we are thankful to CAPRISA of having this particular event in this particular place. We are also acknowledge that we are in level 1 where there is also some restrictions, particularly in COVID-19. Particularly for us as community leaders, we have to ensure that our people remain safe at all time.
Okunye izikhuluma ezingaphambili kwami no program director usengikhavile kona nenduna zangikhava kona. nami bekade ngizohamba kona lokho ukuthi sibonga kakhulu kuSisigethwane umndeni wakaMahlase ngokuthi phela lana bekade kuyindawo kade sithola kuyona izinto eziningi kade zenza sivwaya nembiba la kwenzeka izinto eziningi utshani kodwa ukuthi ke lokhu ke osekwenzeka njengamanje kukhombisa ukuthi kusithanda kakhulu kuCAPRISA ngoba kuzotshala into ethi abantu kufuna baphile isizwe singaveli sibhuqabhuqeke njena kubaleke kakhulu ukuthi thina sisonke nokubambisana.
I'm mostly covered by the previous speakers already of what they've said. Also, they covered me in that regard. Thanks also to Mahlase family for their contribution into this community. As young boys, we used to grow here, cultivating the land and also hunt around these particular areas. But again, we also thank them for their contribution of making sure that whatever that we are planting here today is what is going to heal this nation for the better change.
Okwethu bekungekho okukhulu kakhulu kade ngekuthunywa ukhansela bekade ukuthi ngoba siyasebenzisana nabaholi bomdabu kube ukuthi siyabonga iprogram yendlela eniyenze ngayo ukuthi siya recognize at the same time futhi bekade ukuthi nje uwelcome ukuthi loba ukuthi thina sisebenza emkhandlwini wekhansela njengama ward committee. So ke sibonga kakhulu lokho angizulanda nje kakhulu ingakuthi ngizocela ukuthi ngehlele ngenzansi ukuthi bekade kuyiloko kade ngithunywe nje kakhulu kwazi ukhansela ukuthi sizon welcome ukuthi nikhululekile ka Ward 9 intuthuko eniza nayo siyayibonga kakhulu.
Thank you again for recognizing the political leadership of Ward 9 and also recognizing the work that you continuously bringing in this particular place at Ward 9. Also particularly the development that you bring here at Ward 9. We will continue to work together. I thank you. In my closing,
sibonge kakhulu nokuthi ngoba ngaphandle kahulumeni weqembu elibusayo ANC bevike sibe nawo lo mcimbi ufana nalona siyabonga kakhulu.
We also thank the leadership, the political leadership, which if it wasn't for them probably would have not have this particular event. Thank you.
Thank you so much. Ladies and gentlemen, moving on along in our program, I would like to introduce Pastor Mlotshwa. Pastor Mlotshwa is the senior pastor of the Great Harvest Fellowship Church that is under the Faith Mission Church, African Faith Mission Church. He's an executive member of the AFM in the Midlands region and a chairperson of the board of the Nkosazana Dlamini Zuma community radio station. In addition to all of these, Pastor Mlotshwa is an active member of this community. He is also part of the Mafagatini Taxi Association and, most importantly, the chairperson of the CAPRISA Vulindlela Community Research Support Group, which is our CRSG. This group aims to foster collaborative partnerships between the research sites, study participants, health service providers, and the local community. Pastor Mlotshwa, I thank you. I think you can take off the mask.
Well, greetings to everyone present here. I know in the church we used to say brothers and sisters, but in the event like this, we used to say ladies and gentlemen. So let me use ladies and gentlemen. Be greeted, especially our boss. As much as we are called chairpersons and staff, we do have our boss. The boss is here, is present, is in the house. Professor Salim and Professor Croatia. this is our boss, so we behave when they are around. So I'm behaving with myself as they are here. Greetings to my senior leader, Pastor, and Masitole, program directors, my sister Ketwana, the stakeholders present here, like Wanzeto Mhlope, community, NGOs that are present. We do have our CRSG members, as I'm the chair and the chair of their board. CRSG, the members are present here. Would you please stand on your feet? I can see Tando is still coming so that people will know and recognize you. Would you please stand? Our CRSG members are so Thank you. Bless you. In short, let me say all protocol observed. I would like to start my short message of support with a short narrative. One will have to take heed of it, then I will sit down after that. The story goes like this. A man had a nice vegetable garden. In the Bible, it will be like Nabodi. So this man, one day, his garden was inflated by the pig and the piglets. So they all ran into the garden. So as they were in the garden, the man ran to save his vegetables. He took all the piglets, by 2 of them, took them out of the field. When he was coming back to take another 2, usually pig, when it gives birth, it doesn't give birth less than 10. It's 10 upward. And it's a serious job. I don't want to touch on it. So when he came back to pick another 2, he was so surprised to see the other 2 he took out were running into the vegetable garden again. Then he was like trying to push by all means to carry out the 2, kick the 2. And while he was doing that, the other piglets were running in the garden, and the mother did much of harm in the garden, except the big voice, the pig, that was doing. So the old woman was on the side of the hill, and she shouted to a man. She said to a man, take out the old pig, take out the mother. Don't worry about the piglets. Because the man saw the piglets jumping over the vegetables. He thought the piglets are very dangerous. And the woman shouted and said, take out the old pig out of the vegetable garden. Then the piglets will come out because they are following the mother. Then the man pushed the old pig out of the garden. All the piglets went out. If we say today we want to end the inequality in the society, we need to know what we should take it out. As much as you try to address, as much as you try to give all the nice, good stories to people, writing books, writing messages and stuff, we cannot do it. For us, as we are here, Prof, this is a rural area. In rural area, there is no special study of a man. A man is a man in the rural area. It's known. There is no special study, no workshops, nothing. When we are a man, we are a man. That's it. It ends there. So this patriarchal syndrome, it's what is killing our nation. Whenever we are trying to deal with all the things that we are trying to deal with, but the patriarchal syndrome, it's what kills and destroys people in our society. In this fashion, the woman owns life and the man owns the family. 2 things. A woman is the one who will see that there is no food, and the man will just receive food. The woman will go and test for HIV and AIDS, and the man will win or benefit from the result of a woman. The man will not go to test. Never, forget. He will never go to test. If the wife is negative, then the man automatically is negative. Automatically. Patriarchal syndrome. 2, if the woman insists that they should use condom, then it's a serious case. The woman would lose the marriage, will lose the family, because the men will want to know why condom. What are you doing? Yet the man is having extramarital affairs. But he will ask the woman, why condom? And he will ask the in-laws to come and hear what the woman is saying. Because the woman shouldn't tell the man to use condom, shouldn't tell the man to sleep around. It's only the man who must tell the woman that you don't have to sleep around. So the challenge and the problem we have for our young ladies is not because of their up and down. It's just because the system is oppressing them, pushing them to do what they don't want to do. Because the man always owns that upper rank. Somebody, I don't know who, somebody came with the concept of 50-50. A very nice concept. 50-50. But they could not take out the root. Because when you prune the tree, make it sure that the root is not in the water. Because you prune it and it will keep on growing faster than before. Because you prune it. As we are here, well, it's a World AIDS Day. We commemorate a lot of initiatives that have been done. And at the same time, I need to remember what the then Premier, Dr. Zweli Mkhize, said, that people are affected and infected. We were focusing to those who are infected, but many are affected. So if I'm taking that quote, I want to say to us, as we are here today in this community of Vulindlela, with a population of plus or minus 210,000, it is not a CAPRISA assignment to deal with this. It's our assignment. We are here in the community. We need this Induna to have special meetings where they will address directly the issue of HIV and AIDS, more than the issue of amasimu and potato and other things. Directly. We need our Amakosi to speak openly on this issue. Then we need also pastors. I'm the pastor. You see, as a pastor, it's very difficult to speak about HIV and AIDS because we first condemn the HIV/AIDS person. We think he is sinning. It's a punishment. So when you go to the pulpit, the first thing we speak about is heaven after heaven, is prosperity gospel, you must give. Then when we speak of the HIV/AIDS, my Bishop Stole, you are regarded as a failure. You can't tell people or kids about that. But as we are here on this day, we need to first deal with the patriarchal syndrome to make sure that man owns life, not the family. Woman owns not life only, owns life and the family. It's our own baby. HIV and AIDS is our own baby. It doesn't matter who introduced it or whatsoever. We may have all other excuses that we want to make, but in the message of support to a site director, you will try, push, do whatever you want to do if the community, if the people who are faced with the problem, they do not take it seriously, that it's their problem. When I'm HIV positive, it's not your problem. It's not the doctor's problem. It's my problem and my family problem. And it's not somebody else. Baby, this syndrome of being a man, I am the pastor. You know, when you see people the way they saluted me in the church, everything, it makes me like Jesus. When I'm like Jesus, I simply forget that there is a problem in the community. When men are praised and are worshipped the way we do, they fail to see that there is a problem in the community. But for us, the message of support to the entire community is Induna, Amakosi, the ward councillor, newly elected ward councillor. Apart from, I'm from the most powerful organization, ANC. As much as we want to praise ANC Nduna, we are APC, yes, and others I can see they are from other political organizations, of course we live together. There are moments where we will want to see our community leaders to come together to address this pandemic, because we have families who have lost fathers and mothers, lost kids and everybody. It's our baby, it's our tool. It is not for the CRSG only to do that, but let's join hands, fight this pandemic. Corona is around, it has their people. We are focusing on HIV and AIDS today, nothing else about Corona. I'm speaking on the HIV and AIDS, and it is still there, it capitalizes. Let's thank our principal, the inspector of Vulindlela district, that they are here. Please allow CAPRISA to come to your school now and again to talk with kids. The principal of Kobongwane, Zamukolo, Mafakatini, and all other people, please let's allow the CAPRISA volunteers, CRSG members, the doctors, whosoever, to come and address, because the nation we have, we are losing it. It's either in 10 years to come or 20 years to come. I thank you. My 5 minutes is gone. God bless you.
Thank you very much, Pastor Mlochwa. I think, not so long ago, we had the Isibaya Samadota campaign here. And we are dealing with sexual transmission of HIV. Men and women have to take responsibility, and I particularly appreciated your underscoring of where power lies. And that power is meaningless for us and life if we don't uplift everyone, and it's not leaving anyone behind. And that we are all working together, the Department of Health, the community leadership, and the scientists. None of us can solve these major problems. And even though you didn't mention COVID-19, we can't forget COVID-19 as we deal with HIV, nor can we forget HIV, because there's so much more to be done. So now we're going to have a few messages that are that have been recorded. And we're going to start with a message from Ms. Sibongile Shabalala, she was devastated that she couldn't be with us. She's the National Treatment Action Campaign chairperson, and she's also, a member of SANAC, very actively involved. She has extensive experience in health advocacy, community engagement, and mobilization. And when we first started to plan this event, she said, "You can't do anything without me being here," and was all ready to get to the airport. So we really miss her physical presence, because I think hearing from her in person would have been just amazing, and an amazing experience for all of us to meet with her. But instead, we have this message, which is second best, but I hope in the future we will all get an opportunity to meet with her. So if we could have that first video playing, and that will be followed by a message from Dr. John Kengasong. As you know, in the next couple of days, the ICASA conference, the big Pan-African AIDS meeting, takes place, and Dr. John Kengasong was initially going to be here and also present. He's the director for the Africa Centers for Disease Control and Prevention, and we all know what an amazing job he's been doing for Africa in terms of securing diagnostics, in terms of securing vaccine doses, and now also working for new treatment access. So, so over to the messages, and then we'll move on to the next item. Thank you.
Hi, I'm Sibongile Chabalala, the National Chairperson of Treatment Action Campaign. It is my pleasure today to talk to you about the issues of HIV and AIDS in South Africa. I'm sorry that I couldn't attend this gathering physically due to other challenges. However, it's also my pleasure to talk to people about the issues or the challenges that we are facing in South Africa on the issues of HIV. We know that we have gone a long way as South Africans to make sure that ARVs are available in the country, and also to make sure that people are initiated on treatment on time. We know that we started as a country. People at first they were initiated on treatment with a CD4 count of 200, and later it was 350, and then later it was 500. But now we are talking about test and treat, where when you are tested positive, you are also put on treatment. And that is a strategy that we think as South Africans it will work. And we thought that when people are tested and treated, we will manage to save more lives. However, we still have so many challenges on the ground which hinder us as South African to manage the HIV like we wanted to do. As much as I've said earlier on to say we have more than 8 million people who are living with HIV, we only have about 4 million or over 4 million people who are on treatment. And that is still the problem, as much as we are in a half of that number. Remember, we are also losing other patients on treatment because the issues of counseling and preparedness for patients to take their medication and to understand why a person living with HIV needs to take medication for a very long time are no longer done properly like it used to be. But also the issue of services on the ground are not as what politicians are saying on the national level. We know that we are facing so many challenges in terms of people living with HIV had to wake up around 3 a.m. to make sure that at around 4 a.m. they are queuing outside the clinics so that they can just go get their medication. We know that there are no youth-friendly services for young people who were born with HIV and those that we know that are infected with HIV later on. In the past few years, we were talking about young people over 2,000 who were infected with HIV weekly in South Africa. The question that we need to all ask ourselves is that where are those young people today? How are they getting services, or how are they?
So let me start by thanking you for the organizers for inviting me to be part of this very important occasion. We've lived with HIV/AIDS for the past close to 40 years, and unfortunately, it has caused tremendous harm on the lives of millions of people. At least 40 million people have also died because of HIV/AIDS since it was first described. We have also come a long way. We've come a long way in understanding the disease, how it can be treated, and how it can be managed, to the extent that today HIV/AIDS can actually be considered as a chronic disease. We've come this long way because of global cooperation and global solidarity, thanks to the efforts of initiatives like the Global Fund, to the extent that the President's initiative to eliminate HIV/AIDS, we've commonly called PEPFAR in the United States, and other initiatives and global solidarity. This symbolizes that together as humanity, if we are willing to and are determined to act boldly with solidarity and cooperation, we can solve big problems, including those that we face and currently face with HIV/AIDS. I just want to be very clear that HIV/AIDS remains a pandemic in most parts of the world, and a pandemic that we cannot ignore, despite the remarkable progress that has been achieved so far. In order to continue to maintain the gains and even make further progress in the fight against this pandemic, we have to take personal responsibility. We have to count on collective responsibility, but also make sure that we do our own part. In order to continue to maintain the gains and even make further with the authorities and imposing self-accountability. Personal responsibility. This progress has been achieved. That is, the progress in fighting HIV/AIDS has been achieved thanks largely to the availability of the antiretroviral drugs that have been made available, thanks to the research, remarkable research that has gone into this initiative over the last couple of years. We've all benefited from the fruits of good science, and we continue to believe that HIV/AIDS will be eliminated or eradicated if science continues to progress and we continue to take personal responsibility and collective accountability as well. Thank you once again for the opportunity to be part of this very important HIV/AIDS will be eliminated or
thank Ms. Shabalala and Dr. Kengasong for those messages. There are 2 more recorded messages to follow, but before we do that, we have a small poetry reading, and I'd like to call on Ms. Getwana Malasi to actually introduce our poet, Mr. Siyabonga Pungose. But you've heard the name Getwana Malasi. I'm not sure she needs much introduction. Almost every speaker has honored and recognized her. And come up, Getwana. And Getwana started off her career as a nurse. And for those of us who've known Getwana for over 3 decades, know she's a very versatile and enterprising young woman. She has a wonderful NGO here called commemorate that really creates opportunities for young people in this community. And Getwana is always full of creative ideas and new solutions. And I really am very excited when I see her to see what is her new project and what's the latest challenge she's taking on. But I don't think many of you know that Getwana is currently pursuing her PhD. So she is, definitely we should give her a big round of applause. And when she told me about a year ago that she is, this is the last degree she wants to do, and will I supervise her? I said, of course. And she's been one of my best doctoral students. And again, I will wait to see after Getwana gets a PhD, what will she do? But importantly also today, Getwana is representing the Malasi family. You've heard from the welcome remarks how important the family has been over many decades from her father's time, ensuring that this community in Ward 9 has the Mafakatini clinic here. And as she brought the invitation from the now late Nkosi Zondi to come and meet with him and partner with him in enhancing response to the epidemic way back in 2001, even before CAPRISA was established. She's been the messenger, and she's also been an important catalyst facilitator, an important part of what we are doing here and continue to do. So thank you for that, Getwana, and over to you for your introduction of the poets.
Sanmonang, all protocol observed. Siyabonga warned me I must not introduce him because I'm going to spoil his presentation. He is well known, and we'll hear more about him through his poem. I'm done.
My name is Siyabonga Mpungose, all the way from Mpopomeni. For those of you who listen to Ukhozi FM every Friday, we have poetry slots there. I am a Zulu poet, so if maybe you could please assist, maybe just to translate to others what I'm saying. Like a public yaxolisa khona. Sacela ngishayele inkulu izandla nguSiyabonga Mpungose kabalami sengikhona. Ngiyocela nilekeleleke ngokutolika nganzasekhaya. Izolo bengisesibhedlela bengingaguli, but njengomuntu omusha ngithe angigudle ngihambe kuyozibukela. So kwamanye amawodi bekuyinoma flu bebekhwehlela. Ububona ukuthi umkhuhlane wamakhaza nje ozozidlulela. Uma ungena ngasemnyango ogogo nomkhulu bebekhala ngokuqakamba kwezinyawo, onesi bebalula amajaqamba bebaqeda amahlala khona kabawo. Izolo bengisesibhedlela manifisa ukwazi ukuthi ngiboneni ngicathi ngashona khona ke niyozibonela. But okubeka kakhulu elapho ngidlula khona kwenye iwodi eSubsaw bebenqamuke ingalo nemlenze. Mangibabuza bathi babedle utshwala beshayele bona babe izikhokho zezwe. Basebetshela mina kunethuba ukuthi kwashayela uma uphuzile ngoba bona sebenje ngetear gas bangalithokozela elinye ithuba but baphuzile nina ngicane bekudlala esibhedlela bekushubile. But okubeka kakhulu lapho ngidlula khona ingane encane ena 14 years simboziwe ngoba kuthiwa isishonile. Odokotela nonesi bathi bahlulekile ukuyibelethisa ngoba isencane bekuzoba ngcono kube kumuntu omdala bese ekhulile. So bengilokhu ngigudla ngigudlile angiphiwe kunye kungithusile ngoba ngicine sengilale ngingadlile. Izolo bengisesibhedlela manifisa ukwazi ukuthi ngiboneni ngathi ngashona khona nekeni yozibonela but okubeka kakhulu ke ilapho ngibona khona omunye usisi obebuye eseqinile but bengisaba ngisho kumbhenga ngoba icondition abekuyibi ngalungile onkosi ngenze njani ngoba lokho engijongile but uyangiqhweba kumina ngaze ufuna ukusho okuthile athi ngiyaza usangiboni kahle ngoba umuntu usegulile but high school ngangade ngifunda nangu uMadlala Silindile ngathi muphi yena lo wasempopeni wayidehlani phile wathi ya ngiyazikhumbula lezo zisuku kodwa manje umhlaba sewushintshile ngoba amaphilisi angiwadlanga phela namhlanje sengidefaultile sengicela ukuthuma wena ke okwazi ukuthi akhulume nesizwe ukuthi sizwe utshela abantu abasha lo myalezo ukuthi abawuzwe ukuthi asisize izidlela ezinqamlelayo emfundweni kubamba ezingelayo izolo besikushaya indiva ngoba sisiyaziphilela phela mina namuhla sengisesibhedlela ngiyazigulela ubatshela ukuthi ngithe aboyinqanda endleleni eziye engwarini nasemaphathini ngoba indlela zasemaphathini sihamba ngophathini but ukuswedwa mangabusuye enhlabathini wakhwehlela ephindelela yadumela phezulu imishini ngagijima yabiza odokotela safika seyicishile bathi alehlanga lingehlanga bese kushaya isikhathi bamboza amazwi akhe asalidlala kimi ingakho namphakathi wasemafakatini ngithi namhlanje ngizowadlulisela kini ukuthi izolo bengisesibhedlela manifisa ukwazi ukuthi ngiboneni cathi kushibhile ngashona khona niyozibonela siyabonga mpose. Okay guys, please help me with the translation ngiyacela ngazasekhaya once I'm done. All right, sengisuka ke mavele sengiyakhumuka kakhuleka. Ngikhumuka kanje. This is a story about my sister. Niyafisa ukumazi ukuthi waphile lapha? Niyafisa ukumazi ukuthi waphile lapha? Qala uzwe ukuthi usuka phi. She's my sister. Sinomama sikhathanisa usizi ukuze athole imali yokuyoregister. Khule kahle ke shayi unlike other girls aphila ngokuspida. Esontweni lethu kwaqhathanisa umnikelo epulpit kwazise phelisisa bemvuma namaphoyinti and uphase kahle ke plus zonke ifundo beyishaya ngo-A+ ngaphandle kwe-geography ngathi yena kuphela athola u-79 kodwa ke akusenani ekhaya isikhulu sekulona isikhulu sengakushisa impepho ingakho bemshiselayo ukuze akwazi ukulisa nesipepho angahlangabezani nasendleleni usepakishile egcwele emfiye esikhwameni kodwa umama umbizele eduze eceleni uthi mntanami awuphelele ngakho ke esikhwameni sakho ngicela ungifayile incwadi engcwele mntanami uyazi ukuthi kulo mphakathi wasemafakatini siyinhlekisa base sithemba wena ukuthi uyakusiphakamisa and akunalutho liyakuphazamisa amazwi kamama ugcine semqinisa athi mntanami nami kube ngafunda ke yamoto bengizokuhambisa. This is a story about my sister niyafisa ukumazi ukuthi waphela laphi qala uzwe ukuthi sekuphi angisamboni kahle ngoba sese-university kodwa isiXhosa nikeni university isidulu senkukhu usibona mdaquthayo angisayiqondi impilo ayiphilayo umazi njengomntwana othandazayo umazi njengengane ethandezayo izincwadi but evasithi sefuna ukugaxela esitayileni usekhohle ukuthi wayileni usengene eshiye etshwaleni uphila ney'ngane zasemasabhabhu sibe zalelo dakeni impilo isinzima kakhulu ke ngasekho nogogo wayilekelela ngemali yempesheni ucela imali kulala ingadli ukuze kufundene esikoleni but this is a story about my sister niyafisa ukumazi ukuthi waphela lapha qala uzwe ukuthi sekuphi ngebhadi umama wayengafundile so ifika axoxele yena ukuthi ngiphasile but emva kweminyaka ethile wayesebuyile eseshayikile eseney'nkomba zokuthi akaphilile esephethe izitifiketi ey'mbili esakhe sokuzalwa nesengane yakhe yomfana ubulili uyisengane wamgcina eseney'nyanga ey'mbili but this is a story about my sister niyafisa ukumazi ukuthi waphela lapha qala uzwe ukuthi sekuphi usesemjondolo ekhaya emva kwendlu mshena maye wakaphilile esiswami ngizomgada ukuthi nami ngiphuthuma la isimo ekhaya siqondile and okubuka kakhulu ukuthi umama emhlabeni ushile and ngicela ngingahlekisi kamane ngibona ngilambile hlamba ukudla ngigcine ngey'nyanga ey'dlulile but nginethemba lokuthi impilo engcono ngiyoyithola namzukwane sengifundele. I'm so sorry unishiya le nkonzo kayiqedile but lolu ucingo olungibekela usisi emhlabeni ushile ningane yakhe ekhaleni eceleni yamkhalela ayishilile phela ube defaultile. This is a story about my sister nafisa ukumazi ukuthi waphela lapha and lo suke simfihla kusasa emathuneni siyabonga mphokoza.
But why must it be me to translate this? Okay, in the first poem, the poet is telling us a story about his visit to the hospital. I will summarize. He met many different people. The first group was old people who were being helped with the exercises because of the joint pains. The second person that he met was a 14-year-old girl who was already dead because she had just delivered a baby and the doctor said she was too young to deliver a baby and she passed on. And then he also met with people who were limbless, no arms, no legs. And they told him that they were driving, being drunk. And then they met with this accident and they lost all the limbs. And they wished that they could still be alive, be given a chance, and they were warning him not to do that. And that when you die, you are alone. And yes, that is all I had, or that I was able to capture. And then the second poem is about his sister, which I think would resonate with some other families where children go to school, go to universities, and then they end up doing other things. Then he says the sister, because they did not have money to send her to the university, the church was kind enough to donate some money for her to go to the university. And then the mother, or at home before she left, they had a ceremony to praise the ancestors. And then the mother also opened the Bible and gave her the Bible as her guide when she is in the university. But the mother also wished that she had been to school because she would have bought herself a car and she would have been able, I see him nodding, yeah, she would have been able to take herself to the university, but then he had to get public transport. And then life changed. The question, the title of the poem is, you want to know what happened to my sister? So now, when the sister got to the university, things changed. And when she came back with 2 certificates. One was the baby, the certificate of a baby, and the other one was about HIV. And unfortunately, she also passed on. Thank you.
Thank you very much, Yabonga Gakulu. And I think even though some of us didn't understand the Zulu, we felt the passion of the poem. I want to thank Getwana for capturing it in a translation, the key messages as well. So we have 2 more messages that are video recorded. The first is from the South African National AIDS Council CEO, Dr. Thembi Kulo, and then followed by Dr. Nicholas Chris, the Acting Director General of the Department of Health. And some of you may be aware that tomorrow will be the big National World AIDS Day commemoration, and that's taking place in Waterberg. So both of them really wanted to be here, but the travel time between the provinces didn't allow that. So they felt this event couldn't be complete without messages from them. So if you could just have those messages, thank you.
Good day. My name is Dr. Thembisile Kulu, and I am the CEO of the South African National AIDS Council. SANAC is a national body established by Cabinet to coordinate the multi-sectoral response to HIV, TB, and STIs by bringing together government, civil society, private sector, and other important stakeholders. Program Director, I shall begin by registering my sincere apologies for not being able to join you physically at CAPRISA for this important engagement. CAPRISA, and in particular Prof. Q, have been very supportive of all SANAC initiatives, and I really wish I would have been there to join you. But as you all know, SANAC is leading the National World AIDS Day commemoration for South Africa, which is happening in Limpopo, where His Excellency, the Deputy President of the Republic of South Africa, the Honorable Didi Mabuza, will deliver the keynote address in his capacity as the chairperson of SANAC. This year, we are commemorating World AIDS Day under the theme, Working Together to End Inequalities, AIDS, TB, and COVID-19. Our tagline is get tested, get vaccinated, adhere to treatment. This is a clarion call for all South Africans to unite in the national effort to end these colliding epidemics, as well as the ongoing coronavirus pandemic. We have been warned of an impending fourth wave, and although we are still trying to understand that further, we urge every South African to get vaccinated, especially people living with HIV, TB, and other chronic illnesses. The vaccine may not be a silver bullet against COVID-19, but it does aid in minimizing severe COVID-19 illness. Government has invested considerably in the provision of vaccines. However, due to fear-mongering, misinformation, and conspiracy theories, some people have been very reluctant to take the vaccine. I am a medical doctor by profession, and I am fully vaccinated. If I can vaccinate, so can you. We also urge the people of South Africa to continue to check Kabilo so that they know their status, not only for HIV, but for TB, their blood sugar, their cholesterol, as well as their blood pressure. Early detection of diseases enables you to make informed life choices. Early initiation of HIV treatment is also the key to enjoying a longer and healthier quality of life. We appeal to men in particular to change their attitudes towards accessing health services. Men's reluctance to access health services timelessly remains a challenge against the country's response to HIV and TB. We call on all men's movements, on community leaders, on religious and traditional leaders to engage men about the importance of health-seeking behavior. The midterm review of the current National Strategic Plan for HIV, TB, and STIs for the period 2017 to 2022 revealed a slight decline in new infections amongst adolescent girls and young women aged between 15 and 24. This decline was from 2,000 new infections per week to around 1,300. Although this is a slight glimmer of hope, they continue to be the hardest hit compared to the general population. This calls for targeted and tailored interventions to change this narrative. We have also seen a steady increase in new infections amongst adolescent boys and young men, and we need a comprehensive response to ensure that we address this development timelessly so that young boys are not left behind and that the older men who are impregnating our young girls actually face the consequences. The overall decline in condom use over the last couple of years remains a serious concern to us as SANAC. Condoms remain the easiest and most accessible method of preventing the spread of HIV. We therefore urge all South Africans to access the free scented Max and Maxima condoms from all public health facilities across the country and to use these to enjoy safe sex and prevent not only unwanted pregnancies but HIV as well as other STIs. Together, we can end HIV as a public health threat. Get tested, get vaccinated, adhere to treatment. I thank you.
Good day to you all at CAPRISA, Professor Karim and his colleagues, and good day to everybody at the Vulindlela Sub-District. Thank you very much for inviting the Minister to come and speak to you on World AIDS Day. Unfortunately, the Honourable Minister has got many other obligations at the moment, and it's impossible for him to be there. And likewise for me with the the COVID activities that are going on, I can't be with you either. So as the Acting Director General, I would like to, on behalf of the Minister and the whole of the Department of Health, congratulate you on the amazing work that you've been doing and the commitment that you've made towards the HIV/AIDS, tuberculosis, and the COVID-19 pandemic response in your area. It is always essential that community organizations take control of their own lives, and it is really encouraging to see it when community activists and those who live within a community take control. So in terms of where you are and where we are as a country, there's just a few things I would like to convey. The first one is that the world has gone crazy. The COVID-19 activities and all the other pressures of voting and elections and other things that distract us in our day must not distract us from our focus on managing and controlling HIV and AIDS. I would really like to encourage you all, and working with those at CAPRISA, refocus and make sure that we meet not just the 390s, but the 395s in the year ahead. It's very important that we continue to focus on all the activities around HIV and AIDS, including the control and management of sexually transmitted infections, and not just of HIV. So that's the first thing. Please do not lose focus. I know that we all have to spend time on other things at the moment, but we cannot allow all the work that's been done to slip. The second thing is that the world is changing really fast around us. And one of the things we have learned in the past 18 to 24 months is that there's a whole lot of new technology opportunities, especially the use of cell phones and mobile, smart technology, the processing of that data, and so on. These technologies that we have and the improvements that we constantly see in laboratory diagnosis and management of the services that we run are not to be taken lightly. We need to use them. We need to step up our impetus. We need to use this technology and engaging with the communities to make sure that we get data quicker, more comprehensively, and from a wider range of people benefiting from the services that are being provided. So while some of us might be threatened by the new technologies and struggle to use them, I really want to encourage everybody to embrace what is happening with those technologies. That can be expanded to new treatment modalities and combination drugs that are available for the treatment of HIV and AIDS. So we should see this as an exciting opportunity going forward. I also want to note that while the Department of Health nationally is responsible for policy and for supporting and providing the stewardship and coordination for health services, which includes HIV/AIDS and sexually transmitted infections, tuberculosis, etc., it is also our mandate to see to it that what we do has the necessary scientific basis. And so I would like to commit the department to continued support of scientific activities. And that's not just laboratory-based science. We're talking also community-based science, the epidemiology of what happens, as well as the high-end laboratory testing and the experiment and everything else that goes on behind the scenes to ensure that we have the evidence we need to make the decisions we need to make, and therefore to catch up with our the control of these various diseases we have to look after. As we head into 2022, we know that we are going to have a difficult year. We are likely to have COVID around for many years, and we are likely to have our social fabric disrupted by the control of COVID. But for those of you who've worked in the HIV environment and continue to work in the HIV environment, you know that this is what happened at the start when we first discovered this new disease, which later became known as AIDS, and which we later, even than that, discovered a virus for. We have made great strides, thanks to people like yourselves and the activities that you do in the community to improve that control. So I have no doubt that going forward, we as a nation and as communities banding together will get control of COVID as well. But please remember, we cannot, because we are struggling with one illness, lose focus on the other that we've worked so hard for so long to get on top of. So on behalf of the Department of Health nationally and for the Minister, I once again would like to wish you well on this World AIDS Day and request that you remember the many who have suffered and who have died in getting us to the point where we are today, and commit ourselves to doing better in their memory. Thank you very much.
Thank you so much. So while COVID has us sitting 1 meter apart, not able to shake hands, not able to hug, we are still brought together on the virtual platform. We are so grateful for the videos that we've seen and that we've received from our other guests. Carrying on with our program, I would like to introduce Dr. Mamosa Chapalala. Excuse me. Dr. Mamosa, pardon me. I want to get this right. I want to make sure I get this right. Apologies. I don't know if you can tell I'm a little bit nervous. Okay, thank you so much. So Dr. Mamosa is the acting Chief Director of Strategic Health Programs in the Department of Health in the KZN province. She led the district in achieving and sustaining quality standards in health service delivery. Dr. Mamosa is an assessor, a moderator in the nursing education for South African Nursing Council. Her publications have focused on health system strengthening and using information for action. She's committed to collective efforts in mitigating the HIV scourge and sharing lessons learned. Dr. Mamosa, thank you so much.
Good afternoon, everyone. Esteemed guests, all protocol observed. You know, coming here, being assessed, screened, in fact, screened before coming here, having to produce my vaccination card, that communicated to me that this is serious. We mean business here. We are really committed in improving the lives of the people that should be in attendance here. So this was very encouraging. And coming here, after the people that have spoken there are some words that came to me. I started writing them down: compassion, courage, resilience, unity. When you see the community working with the research institute, ownership, confidence in what we can achieve if we are working together. Believe that we can make a difference. Endurance, you can endure these challenges, and the activism against inequalities that was portrayed here. And, you know, actually addressing the cultural drivers of some of these pandemics. This was really exciting to see how we actually understand our context. Because if you do not understand our context, there is no way you can be able to have tailored interventions to address the challenges that are faced with our communities. And this year in 2021 marks 40 years of the global response to HIV and AIDS.
So it is a very important year, and we can look back and take stock of what have we achieved. We know where we come from. And aligned with the theme, working together to end inequalities, AIDS, TB, and COVID-19, we are inclusive. Get tested. I'm reiterating what Dr. Kulu said. Get tested, get vaccinated, adhere to treatment. As one was taking a tour, we were told about the community workers that actually go out, liaise with the communities. And to me, what came into mind is, you know, the adherence rate here must be high. And when I looked at the laboratory, I asked about the turnaround time of viral load, which was 2 hours. Then I said, you cannot say that we have unsuppressed viral load here, because people can get their results in 2 hours and then action taken at the same time. I just want to salute the work that is being done here in that relation when you look at prompt action and addressing the, you know, the challenges that are faced by the health system. I've just prepared some priorities that I thought it's important to communicate, such as population health. Our approach should be population-based. We have to address the needs of the population that we are serving. So with the population approach, we'll be able not to waste again, isn't directing the resources where they are not needed, but we'll direct the resources where they are needed and where we'll get returns on our investment. And the greater involvement of people living with HIV. I want to say, CAPRISA, you heeded the call in this regard. Now, nationally, we are talking about GIPLIV, because we believe that there has to be greater involvement of people who are living with HIV. If we are going to make inroads in mitigating the scourge of HIV, then there is a need for greater involvement. We are embracing the dual approach, behavior change, and the biomedical. You know, behavior change is key, but how would they change their behavior if they don't know? So that needs to be communicated to people. They need to understand so that you can influence their behavior. But what is important, again, is that our communication must be age appropriate, taking culture into consideration, taking the dynamics within our communities. And that's the only way we can. And we can actually identify influences within our community that could be instrumental in behavior change. People that are being respected within our community so that the community can win as a collective. Collectivism to mitigate these scourges of HIV, TB, NCDs, GBV, and femicide, as well as COVID-19. It is not the prerogative of the Department of Health only. This is a societal problem, hence the need for collectivism in addressing these scourges. We do need to prioritize prevention, treatment, as well as retention and care. It is imperative that we remove the barriers to access of our health services, discrimination and stigma. But I'm happy because of the relationship that CAPRISA has with Mafakatini Clinic, a memorandum of understanding, how they work together as a collective that actually benefits the community that is served here in Vulindlela. And we need to address the social and cultural barriers, as alluded to earlier. Those cultural barriers can actually derail us in our efforts. We know we have targets that we need to reach. It's not about targets per se, it's about epidemic control, improving the lives. We know the 90-90-90 targets, isn't it? That 90% should know their status, 90% on treatment, 90% to be viral suppressed. But it is important again to note that it's, you know, the taking of viral load and recording thereof is equally important so that, you know, our viral load suppression is authentic. And we know the next milestone of 95-95-95 by 2025, and eventually epidemic control by 2030. And when we're looking at epidemic control, isn't it, you want less than 1%
of new infections, and people should be viral suppressed. So it is important that you address these social and cultural barriers. I was glad when Prof. Q spoke about Isibaya Sabadoda, because those are the interventions that you are embracing as the Department of Health, that you can reach older men. And we have another intervention, Ikosomba Lamajita, which is targeting the younger people, the younger boys and adolescents on the streets. To talk about these social ills, to address them, it is disheartening from the department's perspective to see an increase in the number of condoms distributed, whilst we also see an increase in sexually transmitted infections. If I can give just a statistic of Q2 last year, we had 50,000 that were treated for sexually transmitted infections in one quarter. And in 2021, Q2, which is July to September, we had 77,000. That is an area of concern that, you know, they are distributed. Are they used for the right thing? Seemingly not. Because we are distributing condoms, and yet it's an effective method that can help us in preventing the challenges that we are facing as a department and as a society, as well as a country. Remember, we are the second highest populace. If we can make indents as KZN, as Vulindlela, then the scenario, the change, the scene of the country will change because of our contribution. Let us go out and persuade people to screen and to test for all these gadgets. We really have to promote a PrEP uptake, isn't it? PrEP is not utilized optimally. And yet it is a silver bullet in a way. So let us actually promote the uptake and consistency in taking the PrEP and have these targeted interventions for men and female. I spoke about 90-90-90 at a population level as a province. The first 90 we have achieved, we're at 94. The second 90 people that are initiated on treatment, we are struggling, we are at 85. But our viral suppression is 91%. But that is at a population level. Then when you think of men and children, the performance is not the same. It is better for women, so we need targeted, tailored interventions to address men and children. We know the challenges with children, disclosure problems. So supportive disclosure is warranted, so that they can know why they are taking the treatment to prevent, and psychological support, continuous support to these children, because they end up knowing this, they have been taking maybe this tablet for some time, not knowing why they are taking it, the realization, the anger, so that you can actually help the parents or the guardians to deal with this, because we do have, you know, the cascade for adolescents, it's 80% who know their status, and 65 on treatment, and 62 viral suppression. So you can see this is war. We need to have focused interventions for men and children. The department is trying by developing men's clinics, isn't it? But you know, it is a costly thing to the health system with all the pandemics that we are dealing with. But you know, prevention also, we must not lose sight of prevention if we are to achieve epidemic control. And it is encouraging to see that CAPRISA is actually focusing on these new approaches in their research that are directed to prevention. Because we must not forget about prevention. We must not be taken over by the fact that treatment is readily available, isn't it? The technologies are there, but it is important that we still step back and say, how can we do this better? How can we communicate better with the masses? Vaccination is key, but in our vaccination, let us not forget the pregnant woman. If you can have 27 maternal deaths in one quarter, that is a cause for concern. COVID-related deaths, whereby all were not vaccinated. So let us heed the call. When we talk about COVID-19, we must also talk about COVID-19 vaccination for pregnant women and lactating women. And I must say the partnership with the clinic, the working here, the environment, it is encouraging to be here. And we do believe that really resilience, we will achieve more. As a collective, we can achieve more in mitigating miscarriages. I thank you.
Thank you so much, Dr. Mamosa, for those kind words and that powerful message. I would like to introduce our next speaker, Dr. Margaret Thandeka Zulu. Dr. Zwela and I have started working very closely together, vaccinating healthcare workers under the Sonke trial. We met on various virtual platforms before we actually met in person. Dr. Zulu is the acting district director of the Umgungundlovu district. She strives for service excellence, having advanced through many important managerial positions throughout her career. Dr. Zulu is passionate about health, the health needs of underserved areas, which is the main focus of her research. Her family and her church are an integral part of her life. Dr. Zulu, thank you so much.
Program directors, I normally don't take off my mask. I think I'm loud and clear, or must I take it? No, I'm fine. I've got a shop steward voice. Thank you very much for the opportunity. Program directors, ondabezitha abakhona amakhosi esizwe neinduna zamakhosi, Prof, our icon in KwaZulu-Natal and Umgungundlovu. We are very proud of you, Prof. Salim and Koresha, because all the knowledge, all the research, findings and sharing with us have, made us grow and rethink. For instance, yesterday we were listening to you. I've got the video, and I've shared with my colleagues, and all protocol observed. Thanks for the opportunity. Some of the things have been already covered by Dr. Kulu and Dr. Mamosa Chabalala, but I'm concentrating on Umgungundlovu, and really we appreciate what we are doing with our Department of Health team, our Mafakatini clinic, and really I've been wanting to come here, perhaps work. When I exited the public service on the 31st of December, I thought, Prof, I will be doing more of the research, publishing, but I had to come back to the department for Umgungundlovu district. And there's no time. I just hit the ground running. The theme is very clear. We have the international theme that I was given by CAPRISA as a topic, but also we thank SANAC and civil society, Mr. Mdleje, who is the chairperson of the KZN Civil Society. I can see you are everywhere. You are everywhere. The international theme, which says end inequalities and end AIDS. But as KZN, they also worked on the theme in line with the national department that says working together to end inequalities, AIDS, TB, and COVID-19. get tested, get vaccinated, adhere to treatment. I want to say, ladies and gentlemen, in KwaZulu-Natal, we have Operation Sugumasake. As Dr. Shabalala said, it's not a Department of Health problem. HIV, TB, all other social ills are a societal problem. Hence, I challenge the leadership here, I challenge the new councillors here that they must drive. They must drive programs that will eliminate or eradicate these social ills. So, as Umgungundlovu, we also are saying, let us excel in what we do. We know there are challenges. When we were just about reaching the 1999 as Umgungundlovu, there came COVID and, just distracted us because we had to shift focus. But we are concerned also about the adolescent girls and young women. So the concept document was very clear. We still encourage people to know their status, to get tested, know their status. Yes, as Umgungundlovu, we have achieved currently the first 90 and the third 90. But remaining them on treatment, it's a problem. We are having defaulters. As you know, Umgungundlovu is also serving other people from other districts and other provinces. We lose them there. Also, they don't come forward to our facilities. We have learned, Dr. Shabalala, that our people now are scared of our clinics. They don't want to come to the clinics. But with our partners, HST and others, we've tried at least to get to them. You know, Prof, the COPC, it's what is driving us, the community-based model, to say, let us serve the people closer to their families or their communities. So they've assisted us in delivering, treatment. Because it was not easy for them to come to our facilities, especially during the lockdown. It's where we lost many of them. And we have our clinics that are youth-friendly, but we still want to add more. But most resources are always a constraint. Because we want to target these young people, both boys and girls. We do have clinics where they come chill, discuss their issues. But we want to go broader. And also, we have a challenge with family planning. Because people mustn't get, unwanted babies. They must space and they must, have control over their bodies. But some of us as women, we fail or we don't succeed in negotiating with them, with their husbands. Yeah, Pastor Mloja said it. Good to their men. They are heads of families. So we listen to them and we are submissive. Same for the condom. Same for the condom. Women will like to use the condom, but because they are scared of their husbands, they are scared of their mamazalas, their in-laws, so they won't come. Those that will be using them, they will just use the Kokoba road. Yeah. So that is not right. They have control over their bodies. They also have rights that must be listened to. PrEP, also, tomorrow it's a World AIDS Day. Umgungundlovu is in Richmond, Ward 1, Townlands ground. As the Department of Health and Umgungundlovu as an NHI also resourced site, we will be having our trucks there, we'll be providing services, and we call for integrated services that we screen for everything: HIV, AIDS, TB, non-communicable diseases. You also screen for COVID. We test them. We know that due to adjusted level 1, the target population is only 500. But we are saying to Ward 9 Councillor, I will look at you, Babum Tembu, because you are standing in for Councillor Shabala, to say you should know everything that is happening here. You should know every family. Who is an elderly here? Who is at risk of being assaulted or raped? Who is at risk of not taking treatment? We have to support, and leaders leading by example. They should know ukuthi KwaZulu here is on antihypertensive drugs, is on ARVs, and needs support. Same for the pastors, the ministers of religion. They mustn't be shy of talking of all these social ills, including teenage pregnancy. In the churches, Babumloja, you have specialists, you have clinicians, you have a social worker, you have a professional nurse, you have a doctor. They are sitting next to each other or one another. But what is their role? Make use of those people. We are saying once people start treatment when we are not doing well, let us support them. You know, it's not nice. I know I cannot be taking Panado every day. So I need that encouragement. And also with the social substance abuse, he gave, Usiabonga gave the poet on limbs, amputated limbs, because of substance abuse. It's where we get these problems, because people fail, they fail to remember that they must condomize, and what is it that they need to do that is right. So as the community, as leaders here, we should be passionate. We should be having programs that will address all the youth in the area, Emafakatini and Pumuza. So that will, you know, hinder them from doing, and also occupying them. Occupying them. We are happy that CAPRISA is having our youth, and you know, they are being occupied because there is high unemployment rate, we know, but they mustn't be just loitering. Make use of them. So checking Pilo is still here. It's still here, and we emphasize on checking Pilo. And we have a problem of males coming to facilities, of males getting checked, medical checkup. You know, when I talk to people, I say, perhaps on your birthday, or on the men's month, or during a women's month, take all, you know, medicals, check everything from head to toe, like my mother does. So then you are able to be diagnosed early, treated accordingly. So we've had males just, you know, dropping dead. We've had that in our Umgungundlovu. We don't want that to happen or to continue. So let us prevent the impact of the fourth wave. The professors and them are telling us about the fourth wave that is coming. Already, we are increasing our cases on a daily basis. I mean, Umgungundlovu and also KwaZulu-Natal. They are increasing. We've heard, we've seen what happened in Howick. So we are happy that you have complied. And you know, I want to echo Dr. Chabalala. I was also very thrilled to be, screened electronically. So that was just great. So let us make sure that we test, we screen and test for COVID. And also people, these days they tell us there is a huge influenza, flu. People are off sick with flu, but they don't go for testing. And also when we talk to our GPs, let us encourage them to advise people for testing. They cannot be treating people for flu 3 times, come again, call again, without any investigations. So let us prevent the 4th wave of COVID-19. People with symptoms, sometimes there are no symptoms. So let us talk about this. So like tomorrow, there will be health talks where departments, stakeholders will be taking turns on the podium, educating the communities whilst the principals are at the boardrooms for briefing and also for a march. Already, there have been some build-up activities towards the Wellness Day, where we are seeing, cases coming up, where we are seeing, there has been a dialogue. I don't know, perhaps you can take this. There's been a dialogue in Elandscope, where the elderly were saying we hear about the myths, the misinformation, but we are not, we don't believe them. We don't believe them. So also the stigmatization, let us encourage people to eliminate stigma, because people are fearing one another. And also the MEC said, a new variant or not, let us vaccinate. We intend vaccinating about 70% by end of December. Currently the district is at 43. It's at 43%, so we have 27 short, so that we eliminate people from a severity of COVID. So let us end this by talking to the people, by having different programs. We have had programs, but seemingly some are not helping. So let us think out of the box and have new programs. So the MEC says, regardless of the new COVID-19 variant, individuals should still do the following: get vaccinated, wear a mask, sanitize, maintain social distancing, and gather in well-ventilated spaces. We are seeing people in gatherings without any masks, without social distancing. So we need to talk about that and discourage any ill behavior. Yeah.
Thank you so much, Dr. Zulu, for that powerful message. When COVID was first identified in South Africa, I remember I called everyone saying, watch the news, watch TV, my boss is on TV. Now everyone calls me, I saw your boss on TV. And as many of you know, that's a lot of calls, because Slim is on TV a lot. So for those that don't know, Prof. Slim Abdul Karim, he's the director of CAPRISA. Slim wears many, many hats. In short, I will just say he is the member of the WHO Science Council and the chair of the WHO Strategic and Technical Advisory Committee for HIV. He's also a member of the Africa Task Force for coronavirus and the Lancet Commission of COVID-19. Prof. Slim is also a fellow of the Royal Society, which is the highest honor. Thank you, Slim.
Thank you, Disebo. It's a great pleasure and an honor to be with all of you here today. World AIDS Day used to mean an opportunity to reinvigorate our work, our commitment, and our vision. Unfortunately, there's another virus somewhere in between that is taking the attention away, that is taking our energy away. We who have been involved in this HIV pandemic, Gracia and I, for 36 years now, it's a long time. We know the importance of this occasion. We know the importance of reminding ourselves about why we do this. I want to just touch on 3 lessons that I have learned, and hopefully for you, it serves as a bit of inspiration. And these are lessons from both HIV and COVID-19. The first is an S, science. Without science, we are in the midst of uncertainty. When we are uncertain, we get anxious. We don't know what to do. Science throws light. It shows what the situation is. It guides us about our course of action. And it has done so in HIV, and it has done so in COVID-19. That science can only be done effectively with the second lesson. And that's the lesson of P, partnerships. This venue is the site of partnerships. I want you to just lean over on your right-hand side and look at that picture that's on that wall. On the top left-hand corner of that picture is Nkosi Zondi, together with Minister Hanako, the Minister of Science and Technology at the time, and Kuresha, as well as Nduna. That was the occasion for us to build our partnership. It was the sword turning that created this partnership. And that partnership grew because we brought in many other partners. And the picture on the right-hand side is emblematic of the meaning of partnerships. It was also World AIDS Day. It has Nkosi Zondi again. It has the district manager for the Department of Health. It has Croatia on the right-hand side. And the gentleman standing there was the Minister of Health of the United States of America. His name is Michael Levitt. In the US, they don't call them minister. They call them secretary, Secretary of Health and Human Services. This particular place that we are commemorating World AIDS Day today was important enough that he flew all the way from the USA to come and join us here in Vulindlela to commemorate World AIDS Day. It gives you some idea of the importance and the inspiration you have provided not just to our own communities, but to the world. That you have some of the most powerful and important people coming right here. Every head of PEPFAR, from the first to the most recent, every one of them has come here and spent time because they need to see what's on the ground in rural Africa. If they don't do that, they sit in their offices, they will never understand what we deal with in this HIV pandemic. And the third point the third lesson for me, both from HIV and COVID, is an E. It stands for excellence. We have achieved what we have today because we stand for excellence. We will never do something that is second class. We will never do something that is also okay. When you are in this organization, you are doing research with us, you know you can bank on our science. You know that we will do the best possible research. And it's not just in that, it's in everything we do. I only ask you to look around. In the midst of Vulindlela, we have built here a center of excellence. A center that each one of us can be proud of. Excellence is not restricted to people in London, at Oxford, in Harvard and Yale. Excellence is a state of mind, and we take it wherever we go. Every one of us. That's what we stand for. I hope I've left you with that message of the three things that I have learned, among many others. And they are S for science, P for partnership, and E for excellence. Thank you.
Thank you so much, Slim. Our next speaker traveled all the way here. I would like to introduce you to Marie-Francois Marinelli, who is the country director for South Africa, Botswana, Namibia, Lesotho, and Eswatini. Since joining the World Bank in 1994, Marie-Francois, has held a variety of positions focused on public enterprise restructuring, support to public health, public sector development, regional integration, and management of the oil sector. Marie-Francois, thank you so much.
It's very difficult to come after Prof. But anyway, it's such a pleasure. Is it still time to be Sambone now? Or we have past noon, or is it still time? So good afternoon, everyone. It's such a pleasure to be here. And I would start by saying that I feel privileged and humbled to be here at this very place now. When we were coming, I was privileged to be with Prof. Karsha, that I again want to really acknowledge. She's one of really persons that I have so much respect because of, as you mentioned, Prof, the excellence, but I would add the humility. Coming together, it's really tough. So she was explaining to me the experience, how this has started in 2001, and step by step. And we at the World Bank, we say that we are there to disseminate global knowledge. I think that today I would like to disseminate global knowledge. It's really the link between the excellence that you mentioned, Prof, and the communities that are engaged, in this process. And through all the presentations that I've heard up until now, it's a lesson for me. You probably have seen me taking notes. And Prof, what I did not tell you is that before joining the World Bank, I remember in 1993, I was a consultant based in Paris. At that time, I didn't want to join a big organization. I really loved to do consulting and then go back to Paris to enjoy Paris, the theaters and all that. So one day they called me. A consulting firm was doing some work in Uganda. And they were basically doing the development capacity, what they call nationalization of staff. After the era of Idi Amin, they had a lot to do. And the consultant who was following the group of staff that were identified could not make it. So they asked me, could you go to Uganda? So I indeed went to Uganda in Kikara, really by the Lake Victoria, and took the job. And I had the list of staff that I should meet. So I go through the list and they tell me this one died. Then I go to the next, this one died. The fifth one, this one died. I actually collapsed, So that was a way of understanding HIV/AIDS. But the positive part of it is that to see how at that time Uganda took head-on, and I remember at that time they had a high level of incidence of 20 and they went down to 7. I have not looked at the recent numbers. So really, when I'm here and I'm listening and I'm seeing all what is happening, it is really about excellence. And you can count on me to be your spokesperson when I go back to Washington, hopefully if COVID allows me on December 12th, when I'm supposed to go back to see headquarters. I don't want to spend too much time because I think that, there's so much that I would like to say, but just a few points. First of all, the theme of really inequality and in HIV/AIDS. Just for the past 2 days, spending time with CAPRISA and going to visit the centers. And I met a non-Claclan who is coming from a rural area and who is leading the research center, who said that there is no capacity in South Africa. I'm sorry, we have to put it. The point, I see Patrick who took me to the museum. I see Senai who is now a scientist. I think that these are the story, Prof, that needs to come out when we talk about South Africa, that there is no excellence. But what I want to do is that how do we scale that? This morning, Mr. Principal, are you behind there? I see Mr. Principal here. You need to make sure that, I'm sure that there are bright kids in your school that can do math. Are you talking to them about that? That can do science? So this is what we are talking about, How do we bring the capacity? I'm coming from a very tiny island in the Caribbean. And I remember when I finally went to the mainland to do my upper studies, and I came to the school, and I managed to be the top student. Out of 100 students, I was the only Black person. And then the second was from Madagascar. He was of Indian origin. We were the top 2 candidates. We showed them that it is possible. I'm sure, Principal, if we go to your school, I can bet you we can find immediately 10 of these. Can you promise me, I'm not a specialist of HIV/AIDS, but I want to talk about inequality. Can we make sure that in this school, each year, we identify the best student, and if they have the excellent capacity to learn, we find a way to provide them with a scholarship so that they can go, so that in 10 years, we have developed this country. I cannot stand it anymore to hear there is no capacity in South Africa. What are we talking about? This is excellence at its best in CAPRISA. And Prof, I want you to talk to my Vice President. If COVID allows us to, he will come in January, I want the World Bank to know what is happening in Vulindlela. So my second message, yes. My second message really is for the communities. Honestly, I was so pleased. Pastor, I forgot your name, sorry. Yes, what you said, about being engaged with the community, what you said about the men, to change this narrative, that the women have a role to stay in the community. So really, partnership, as you said, bringing the communities, I am sure you give them the right, they will deliver. So I think that really this is my second message. How do you develop this partnership? Again, yesterday I had a conversation with Prof. She spent a few time with me and I'm so grateful for that. And we said it's about collaborative leadership. I don't think that there is one solution, one issue that we cannot resolve together. I was talking of South Africa. You were the best in providing water. And I'm told that, you have the highest losses. I said, bring the people together, put them at work and think through about the strategy. I am sure that they will find the solution. It's this idea of being together, the collaboration. So, Prof, I would like to add partnership and collaborative leadership, because we need to have everybody engaged. So I'm not going to spend too much time, on what I had written because you have already mentioned it. But perhaps since I think you said that, Pastor, you didn't want to talk about COVID. We have to talk about COVID today because if there is one thing, it has shown us that we need to have the platform to have the health system to be prepared for the next one. And thanks to CAPRISA, when it started, I didn't know Prof, but I had to go through 3 persons to have his number and contact. He came to speak to our team and with Prof, and immediately we organized a platform for the 5 countries that I'm responsible for. And what was interesting when they said how they use a social worker to do the first sensitization. This is excellence. You don't need to go and in the US to find out about that. This is domestic solution adapted to the context, So really, I think that this is the idea. At the World Bank, we have tried humbly, and I'm not here to talk about the World Bank, in the global capacity, but maybe 2 things. We help, and I think that we realize that this preparedness of health system, and I think that director in the district, the representative of the Ministry of Health, you spoke about it very eloquently. How do you prepare ourselves? So in Lesotho, in Eswatini, that are smaller country within my perimeter, we have actually put in place a system to prepare the country, and in that context, bringing, as you said, the TB, the HIV, and also using the communities to provide the support. I found out in Lesotho and in Swatini that actually you have this community health worker. How do you nurture them and empower them? So we have put that. And then the last point is that we feel that we are connectors in terms of bringing the development agenda around the issue of health, education, health, women, and how do we empower women. I think that we have come to the conclusion, and I'm so pleased that Pastor, you mentioned it, is that the women should be in the leadership, they should make their decision, they should be empowered. We know that when a woman gets 10 rand, the money will go either for food for the children, for education, and preparing the future. So this is what I see. Thank you so much for giving me the opportunity. I'm very humble of being part of this event. I will be your spokesperson when I go back to Washington because I think that we need to bring that to the forefront. I know that Prof have been recognized internationally, but we need to go beyond in terms of the substance of that. Thank you very much, and of course, thank you, Madam, for helping the community of the region, for the Vulindlela community, to benefit from that.
Wow. Mom, you're trying to know, how do I follow that? Ladies and gentlemen, it is my pleasure to introduce to you Miss Ellie Notier. Ellie is a joint head of the National Wealth Management, a specialist pillar of Investec Wealth and Investments. She began her career in the Morgan Stanley on the Wall Street in New York City, where she worked for 10 years in real estate and debt capital markets. Ellie is also a member of the CAPRISA Board of Control. Ellie, thank you.
Thank you, everyone, today. I'm completely overwhelmed by the incredible speakers I've actually heard today, from the community leaders to the pastors, to the leaders from government and the departments. And now I'm completely humbled to now give some of my remarks. So much has been spoken by politicians or economists of how pandemics such as AIDS, HIV, or COVID-19 are the great equalizer. Viruses can infect and sicken anyone, regardless of age, social status, race, ethnicity, or gender. And in this sense, we are all in this together, and we have all been greatly affected by this pandemic. While this is surely true, it's not actually the full story. Because in fact, there is a differential effect of a pandemic on various different groups of individuals, communities, and indeed between developing and developed countries. So times of international and national crisis, such as those brought on by a pandemic, often highlight and exacerbate the inequalities between individuals, communities, and countries. And as a developing country, which is already struggling with our own unique set of circumstances, we have been very hard hit by this and other pandemics. Various sectors of the economy have been closed or severely constrained and businesses lost. Employment opportunities which were already scarce have disappeared. The economy has slowed and people have lost jobs and their means to earn a living. People are under stress both financially and mentally, and times, frankly, are tough. Our government is overextended and struggling to cope, and businesses are feeling the same pressure. I mean, anecdotally, with this latest announcement of Omicron, just personally, I mean, I've just, in my corporate environment, all the events have been cancelled. No one is going back into offices anymore. Restaurants, businesses who are, thinking that this was going to be the season to get them out of trouble, are literally on the brink of collapse. I get goosebumps as I'm telling you this, because I think that people, I mean, I'm hearing calls, and at Slim and Croatia have been 24 hours on the radio, on TV. We're just about to hit another wave, and it is serious. It is not serious. We have to brace ourselves. But as such, because everyone is so extended, governments are under pressure, businesses are under pressure, we can't rely on them right now, all big business, to rescue us from this predicament. And once again, we have to dig deep and find it within each and every one to come together and lift ourselves up together. Luckily for us South Africans, we are uniquely placed to be able to achieve this very renewal. We have achieved far greater things together and have overcome what appears to be insurmountable hurdles. Look at the amazing work CAPRISA and this community has done within this community of Vulindlela. While not a unique concept, we have a unique African term for what is needed now more than ever, and that is the concept of Ubuntu, a humanist African philosophy where the idea of community is one of the building blocks of society, the belief in the universal bond of sharing that connects all of humanity. Ubuntu asserts that a society, not an individual, gives human beings their humanity. I am because we are. And now is the time, more than ever, that we as individuals have to honor our society, our communities, our people. And we have to ask ourselves what we can do for them. We need to come together and work together to find solutions for the difficulties that we are facing. And as individuals and community leaders, one needs to think beyond ourselves and our immediate circle. We need to identify risk groups and work hard at providing support and solutions to their unique challenges. I've been the talking today from the pastor, from Marie-Francois, from everyone has just been so encouraging. Everyone is so touched on actually the things that are affecting us at the moment. The need to uplift women, You know, the need to deal with AIDS with men and children. I've been so incredibly encouraged. The scourge of gender-based violence, which has skyrocketed during this latest COVID pandemic, must be addressed and stamped out. People must be educated and encouraged to resist from this extreme destructive behavior. We must foster care and respect for one another. And it is up to each of us as individuals to choose whether or not to let this pandemic beat us down or rise us up and to overcome our obstacles. This is not the first and it's not going to be the last. And actually, in fact, it's an opportunity for each and every one of us to stop, listen, reflect on what we actually need to do. Let's use this opportunity to reorientate our lives for the better, to correct the wrong and strengthen and develop the habits which will take us further and higher and allow us to be better humans with a fuller understanding of our inherent humanity. Lastly, a quote by a young man from Ghana called Israel Moore Ayivor. He actually won in 2015 the Best Male Leadership Mind Ambassador, and he's become very famous for his inspirational bloggings and writings. And what he says about leadership is as follows. We are no longer in the dispensation of just age and experience. We are in the era of knowledge and information. Information leads a true leader, and a true leader leads others. The leadership I have just seen in this room today has been unbelievably, so remarkable and so encouraging. I'm so personally excited to go and tell the world and the rest of South Africa about the remarkable insights I've learned today from the community of Vulindlela. Marie, you beat me to it. I mean, I was trying to write all the things and then you just wrote it for me. So I'm not going to repeat all the words you've said, but all of you should be very, very proud of this community you have. Thank you so much.
Thank you so much, Beverly. At this point, I would like to move us on to the vote of thanks and introduce to you a man that needs no introduction. As Dr. Zulu said, Patrick is all over the place. He's everywhere. For those that don't know Patrick Leje, he's the head of community programs at CAPRISA. He's the national deputy chairperson of the Treatment Action Campaign. Patrick also serves as the co-chair of the KZN Provincial Council on AIDS, and he's chairperson of the KZN Civil Society. Thank you so much, Patrick.
Thank you very much, Disebo, and greeting to each and every one of you. I wish we had enough time so that we can talk and talk. I can tell you, Prof Slim have just cutted. I can tell you, Dr. Zulu have also cutted her talk. I can tell Maria Francois also cut. We only have so much time in a day. I wish we had actually enough. I'm not going alone, as you already heard. I have so many heads that are above me. I'm here with Ubabu Zungu from the Provincial AIDS Council. This is Ubabu Zungu. I'm not alone. There's a district chairperson of the civil society, Umamu Ulerato Maloka. Also to note, Mrs. Pumelele, the director from the Office of the Premier, one of the directors. I truly appreciate each and every one of you, particularly Kuma program kubantu abasi-organizele lo mcimbi lo ukuthi ube impumelelo namhlanje, it would have not actually came to what it is today. Really, we truly appreciate it. Ngicela ukusukumisa all the staff sa-CAPRISA. All the staff of CAPRISA just to stand. Oh, I forgot in Zulu. All the staff of CAPRISA to stand. Yes, that's what it is. Probably if it wasn't for you, we would have not have this particular function. But also, I want to acknowledge and also give a round of applause to our VIPs. They are sitting right there. Our study participants. Stand and be observed. Okay, others are actually a bit shy, but really are there. And also, I like to recognize all other leaders that are actually that are here, particularly from Inkosi, Undabezi to Tlabshile, Uluka, Pambatha kamancinci, mancinci kancinane, uma ibathi idedele esokeni. Nisidlulisele our thanks, and we hope ukuthi the king uzolulama ngokusheshsha, Inkosi uZondi. Our CRSG members truly appreciate you. We know Amagalelo, we know your involvement, we know the passion that you have as leadership and what you actually are doing for this organization. We are forever indebted in that regard. And we know that even in our absence, you always represented CAPRISA out there. But again, the real work that you also do is to ensure that you also represent Umphakathi in all the studies that we do. We truly appreciate your presence and also your leadership in that regard. Siyabonga kakhulu. Thank you. Ngibonge kakhulu bonke ubukhosi ikakhulukazi amakhosi endabuko induna zenkosi ezikhona. Ngicela ukunibonga nonke noma ngase ngimbize namagama but siyabonga ukuba khona ngicela sibanekezeni ihlombe. Ukhansela uMduduzi noma engekho we acknowledge his presence and the leadership ayilethile. Siyabonga kakhulu. Siyabonga kakhulu Pastor Mlotshwa for your leadership. I already mentioned that. Siyabonga kakhulu Nyawonhle. If it wasn't for you, ngabe mhlambe we would have not be here today. But because of your leadership also, nokusicelela nje enkosini ukuthi sesifike kulesi sikhathi sikusona. This is a big day for people living with HIV. Others, when I tell them that I'm HIV positive, they're like, you just maybe you want to praise. No, I became HIV positive nearly, how many years now, Lerato? I don't know, maybe 15 years. And I'm so handsome and healthy. Not because of anything, it's because I had an understanding. TAC in the early days of TAC, what we've actually invested in, we invested in the treatment literacy. Before we even had the treatment in 2004, TAC started teaching people about being positive and have that vigor to live long. Our agenda, particularly my agenda as a person living with HIV, is to reach at least 100 years. That is not just a wish. I'm going to reach, leave alone this. I was technically derailed because of COVID. I'm actually a runner. Obomzama will tell you, I'm a runner. But I'm scared of running a comrade. 42, 52, yes, I can do that. And I will continue there after a comrade. So even the absentia of comrade Slomile, our national deputy chairperson, our national chairperson of TAC, we truly thankful. Dr. John Kangasong, we also appreciate his speech. Ketwana, we are forever indebted to your family and the contribution and the vision that your family had to change, because the real leadership is not just about talking, but also it is about doing. I'm not going to get into the speeches Prof. Slim. The poetry, it's hard. You've done a very good job. It's hard to translate it in poetry. But then his message was so mouthful, it was so powerful, but it's so hard to translate in Zulu to Zulu. We do no justice to his work, but we are truly appreciate. Dr. Thembisile Xulu, the CEO of SANEC, I know how much she wanted to be here. And all other videos that we've actually received. Dr. Mamusa Shabalala, I know She was supposed to be a ladysmith for tomorrow's World AIDS Day, but she said, I cannot miss it for the world. We truly appreciate it. But then also that it fit very well with what Maria Francois was saying, and also Prof. Slim what was saying, the partnership. This is a kind of partnership that we have with the government. But again, I have another agenda. That is why I make sure that I bring civil society, because we want to translate science also to be owned by civil society. It is for that reason why I planted the leadership of civil society amongst us today as well. Dr. Zulu, you know now as we're coming a long way with Dr. Zulu. So I'm not going to even talk about her. She's one of those people that are very, very active, and they are agitated when things are not moving. She's just one of those. You'll find her here, you'll find her there, you'll find her here, and then you'll be like, this woman is old. Where she get all this power, energy? Then I find the secret is her heart. She is very, very passionate of what she actually done. Prof. Slim, I actually need to apologize. I've actually robbed all of you. I should have told you to bring your notebook so that you take notes. Yeah, right there. There was a lecture right there that you needed to take notes so that you can engage in thereafter. The issues of science. Without the science, probably we would have not been where we are today. But because we believe in science, that is why probably I'm still alive. That is why I'll continue to live even thereafter. Because I'm alive and I don't have the COVID, not because of AF, no, it's because I vaccinated for COVID. I cannot be a traitor and speak to say people must vaccinate and then I don't vaccinate. Almost I'm amongst the first people who were privileged to say, offered to vaccinate, and then I did get the vaccination. So I want to assure you that let's go back into our homes and make sure that people are vaccinated. And we tell them that these vaccines are safe, these vaccines are actually good. Partnership and excellency, that would tell you, something would tell you. When I came to CAPRISA, I took this book. It's almost finished. It tells you what I take notes every day. So that is the kind of the work that CAPRISA do on a daily basis. You have to work every day. So then that is a part of excellence. Excellence does not just come, but it's something that we build on a daily basis to make sure that we get what needs to be done and be not just to be done anyway, but in a best way. Thank you again, Maria Francois, for taking your time to be with us. Vulindlela, I won't even go back on what you said. That was really, really powerful, but we are truly indebted. And principal, at least other people because Mauya we constitution as South Africa under section 29, the children's right, must conceptualize the children's right in the access to healthcare system. Education is an enabler of health. So these two, they cannot be separated. But then also statistically it is proven that if she stays longer in school until she finishes matric, there are greater chances of her not to getting HIV, but forever she'll be always exposed. But also if she stays further and go to a college or university, her choices, I'm specifically talking about women because they are the ones, he might contest me because they always say also men are abused. That is true. But first we need to agree to say we as men, we're doing a lot of harm, but we need to make sure that we continuously invest into the school children to make sure that they live in longer in school so that they finish their schools and further go further into their studies so that they can be great and be wherever that they want to be. Alexandra, indeed, COVID have actually robbed us all. But I think if we can actually make sure that we all vaccinate, definitely, we will overcome and avert the situation that right now that we are in. We are not saying vaccine, you're not going to get sick. You will get sick, but you won't die. That is a good thing. But then also we know now, because science have already told us, we will actually able to overcome COVID and also go back to normal. Right now, APSA in Joburg, what they did during the COVID, they said everyone must work home, must work at home. But no one has actually spoken about the impact of those cleaners those securities. Probably the security is still there, but no one is speaking about this. The other people who are actually directly benefiting because of AFSA daily opening. So we need to start to marry these different struggles because they are all intertwined. There are interlinkages somehow, somewhere. Thank you very much for those eye-opening. And then myself, and then and then to the program directors and everyone. Ladies and gentlemen, I'm an activist. I can talk until cows come back home. Thank you very much. We truly appreciate it. Sesifike kulolo sesifike kuleyo party ke ye candle lighting. Since it's a World AIDS Day, we need to commemorate. The part of commemoration of a World AIDS Day, we remember all those who died, and we remember our friends and our loved ones, and those who died even before even treatment was provided in South Africa. But in South Africa, we are really happy. Today, at least, we can say we have more than 6.5 million that are on treatment. Then that is a great achievement. Then people are living longer. Already the speakers have spoke a great deal in that regard. Dr. Zulu, Prof. Slim, please may you come so that we can do a candle lighting. May I also call Reverend Umlojwa also to come forth. We call Usisu Alexandra also to come forth, Maria Francois and Fundisi, and please join us here in the front to do the candle lighting. Mrs. Mazeka, our district, umhloli wethu, siyacela eze naye ngaphambili. Babu Makwazi, uze ngaphambili. Mamu Ketwana, uze ngaphambili.
Oh, okay, so you want all here.
Mfowethu omele umshengu, siyacela nawe uze ngaphambili. We're trying to observe the social distancing, but because of your mask, then it's fine.
Everybody has a candle in their bag.
Sonke sinawo amakhandlela, we do have candles in our bags. Ngicela ukuthi siwakhiphe sekuyisikhathi sokuwakhanyisa ke manje. Swapeta makandeletu, do we have our candles? May I see your candles? May I see your candles? Okay, I can see you right there with your candles. Okay, I see as a bazo kanyisa. It's a renewal. It's a renewal of our vows, ending inequality, and AIDS and epidemic. The last one is Zandla. Ngaphandle kokuchitha isikhathi Here's again a light. It's gonna start from one side of the room. At the end, all of us will have a burning candle. That is symbolized life. Estela ubiza umfundisi uSithole eze ngaphambili. Lensizwa ke lena, he actually committed about how many years now, Shatile? For 36 years of love. Then we say from CAPRISA, this is for your wife. For you to have. Hayi wena mfakamnikeza. Cela simnikeze lihlombe. Siyabonga kakhulu. Disable, you promised us to sing a national anthem. National anthem? Oh, please. Let's all rise.
Thank you.